scientists suggest that the human heart has been designed to beat for 150, some even say 200 years. Unfortunately, owing to our lifestyle choices, environmental conditions, and genetic predispositions, many hearts start showing signs of trouble within 50 years. In India, unlike many other countries, the age of first sign of cardiovascular diseases is lowering. Younger and even younger population is getting diagnosed with CVD. There is a real need to care for our hearts, and that's exactly why we are here today. How to care for your heart. Namaste, I am Nutan Manohar, adjunct faculty with the Indian Institute of Management co-recorder, guest lecturer at Vijaykumar, and founder of Me Met Me. And on behalf of Times of India, I welcome each one of you to the TOI World Heart Day Symposium 2023. Every beat counts. We have heard it on various occasions that caring for your heart is essential for a long and healthy life. It starts with balanced diet that includes plenty of fruits and vegetables, whole grains, lean protein, to regular physical activity such as brisk walking or cycling, so that you can have a good, strong cardiovascular system. Stress management is another aspect of cardiac care. Prioritizing heart health through these steps can significantly reduce the likelihood of heart disease and leading to a fulfilling life. However, with insights that we have from a lot of research, we now have measurable, actionable points in the form of the life's essential eight areas that we really need to look into so that we can ensure good heart health. The component of life's essential 8 include updated dietary guidelines, physical activity, updated guidelines on nicotine exposure, sleep health, something that has never been considered before but has now become a part of cardiovascular health, body mass index, blood lipids, again updated, blood glucose, again updated, and blood pressure. So in short, if you have some information about how to take care of your heart, this is a session that you absolutely need to attend, because we'll be talking about what the latest findings are and how you can make simple changes to your life and lifestyle so that you can have a healthy heart. The session of TOI World Heart Day Symposium will shed light on how to care for your heart, which is of the utmost importance for our well-being. After all, cardiovascular diseases is one of the number one killers for human life in India. We have a distinguished panel of experts with us, each a stalwart in the field of cardiology. Please allow me to introduce each one of them to you. We have with us Dr. A.B. Mehta, Director of Cardiology, Jaslok Hospital and Research Center, Mumbai. Thank you, Dr. Mehta, for joining in.
My pleasure.
We have with us Dr. Rajeev Menon, Director and HOD Cardiology, AIG Hospitals, Hyderabad. Thank you, Doctor.
Thanks for having me here. Good morning.
We also have Dr. O.P. Yadava, Chief Executive Officer, National Heart Institute. Thank you so much, Doctor, for joining in.
My pleasure.
We are also expecting the company of Dr. Praveen, Chandra, Cardiologist and Chairman of Interventional Cardiology, Medanta, the Medicity, Gurgaon. Thank you so much to each one of you. And with that, let's dive right into knowing more about how to care for your heart with all the insights we have from research. So the very first question is to Dr. Mehta. Dr. Mehta ji, what are the dietary guidelines for maintaining healthy heart?
Good question. I think that I would say anthropologically, if you see, I think that we are basically derived from apes and rhesus, so we should be largely vegetarian. That's the first thing. The non-vegetarian diet is generally not good, and it has been sometimes questioned that how are we likely to get high-class proteins. But you see, the strongest animal in the world is elephant, and the elephant is vegetarian. So that argument does not hold grounds. Now, as regards the diet I think the milk products are the ones which can supply and lipids, and so therefore the milk, the ghee, and the butter, and the cheese, and all those things should be minimized in quantity. I'm not saying that you should be very, very sticky about it. I think you can, but it should be minimized. Moreover, we must also understand that the major contributor, the bricks of the blocks that occur in the coronary arteries, which eventually result into heart attack or heart disease, is made up of LDL cholesterol, a type of cholesterol, low density lipoprotein cholesterol. Only 15% of the blood levels is contributed from the diet, remaining is the internal metabolism and liver. So as long as you are moderate in your intake, both in calorie and in the quality of diet, like moderate intake of fats, carbohydrate, and protein, and especially very rich items like, for example, yellow of the egg or a red meat, which I think one can easily avoid, then I think he has done well for his dieting.
Thank you, doctor. You have spoken about what to avoid. Can you also tell us something about what to have?
What to have?
Yes.
Yeah. Your diet should be so balanced that it should supplies adequate calories. It also supplies vitamins. So it should be a balanced diet. That would include fruits, vegetables, certain degrees of proteins, like about 50 to 60 grams of proteins. And vegetarians usually will derive that from cereals. And mainly vegetarian diet is dependent on larger intake of carbohydrates, but I don't expect them to change their customary culinaries. So that's perfectly okay. Fruits and vegetables, of course, are very, very necessary supplements so as to give you adequate doses of vitamins which are needed.
And if I may pick your brains on what about salt, because we as Indians, we love our salt. Does that have an impact on cardiovascular health?
Say that again.
What about salt? Does excessive consumption of salt have an impact
okay.
on cardiovascular
I can tell you an anecdote, if you don't mind. Till 1905, there was no salt in East Africa. Nothing, none whatsoever. They didn't know what salt is. And Madhavan is introduced there. And thereafter, the incidence of high blood pressure and coronary disease rose tremendously. The salt intake, approximately 4 to 6 grams, which may be a little bit tight, but I think sometimes 6 to 7 grams of salt in a day is your total rationing, total quantity. And excess of salt with the water retention, rise in blood pressure, is definitely something which I think is undesirable. And I totally agree with you that Indian diet, we all are very fond of salt, and I think we'll have to learn how to avoid salt. Therefore, a moderate quantity of salt, which is about 4 to 7 grams of salt per day, should be adequate.
Thank you, Dr. Mehta. That's been really, really helpful. Dr. Rajeev, considering we discussed about food, can you help us understand about obesity and heart health and what strategies can help with weight management?
Yeah, obesity nowadays is, I won't say it's epidemic, it's almost a pandemic. If you just probably stand on any railway station or airport and just gaze through all the people who are standing in front of you and see how many people have pot belly. Almost everyone has a pot belly. 9 out of 10 people you'll find who is having a pot belly. That's a kind of abdominal obesity which is extremely dangerous. Now, what we need to realize is all these diseases don't work in isolation. They are actually partners in crime, each one trying to push the other one up. So a person who is obese is not just obese. He also has insulin resistance, which develops diabetes. He's also hypertensive. He has what is called significant amount of pro-inflammation. So the chances that some kind of a plaque, normally when we say heart attack, it means 100% occlusion of the vessel. But if you look at 100 people who have had a heart attack, you'll realize that more than 50% of them would have had narrowing less than 50%. The reason why that plaque suddenly ruptures is almost similar to a volcano rupture, and that occurs because of inflammation. And one of the major reasons for that inflammation is obesity. So unfortunately, we are the diabetes capital of the world. We are also probably the obesity capital of the world. And this pandemic of obesity is driving diabetes, heart disease, and all the other problems which we are seeing. As you were mentioning in your introduction, our country unfortunately suffers from significant amount of heart disease, and we tend to develop heart disease almost 10 years earlier than Western population. So that's something extremely dangerous and to be worried about. And just taking forward what Dr. Mehta was mentioning, one of the biggest dangers for obesity is carbohydrates, and in that most important is refined sugars. So if there's one message which DOI can push into the general public is to avoid sugar. Probably it's as important as avoiding cigarettes. And just stopping sugar, we can go into a lot of controversies about which diet to eat, which not to eat. But one thing is for sure, if today you stop eating sugar, that itself will significantly help you in reducing obesity. Previously, diabetes was considered as an irreversible disease, a chronic disease, but trials have shown that you can reverse diabetes. How do you reverse diabetes? By basically reversing obesity. So you stop your sugars, that itself will, you won't believe, but that can bring down the weight of a person by close to around 15 to 25 kgs. We have seen patients in whom diabetes has got reversed, they have gone off insulin, they have gone off their oral hypoglycemics. So that is the significance of stopping sugars, and that has to start from childhood. It's important for us to realize that there is nothing like a healthy diet for a heart patient and a healthy diet for a normal person. A healthy diet is a healthy diet for everyone. So somebody who had an angioplasty or a bypass surgery, you sit and put just boiled vegetables in his plate, and beside him you sit and then slurp some ice cream or something. It doesn't mean that you are eating a healthy diet for yourself. You are also not supposed to eat that. So a healthy diet has to be healthy for the entire family. So it has to start from childhood. A class 3 student, class 4 student, they drink 2 or 3 bottles of Pepsi or Coke every day, which contains almost like 15 or 20 teaspoons of sugar. They are going to develop obesity. So childhood obesity is a major issue that is translating into this premature atherosclerosis and this pandemic of heart disease. So no sugar, please. And that itself, first start with that. Then you can of course go on to other aspects of dietary management. And of course, hand in hand to avoid obesity or to treat obesity will be exercise. And previously the thought process used to be just do walking or running. But now it's like a combination. So it's not just the aerobic exercise, but you do some strengthening and stretching exercises also. So you keep the body in shape, and that reduces the insulin resistance, improves the insulin sensitivity, and again helps in treating diabetes as well as in reducing the chances of heart disease. So good diet, exercise, prevent obesity, that will to a large extent reduce diabetes, hypertension, and your chances of heart disease.
Thank you, Dr. Rajeev. I think that was a very interesting point that you made, that there is not a separate diet for a person with a cardiovascular condition and another one for a healthy person. Both of them ought to eat healthy, balanced diets. So thank you so much, and thank you for letting us know that we definitely need to get moving and exercising too. With that, the question is to Dr. Praveen Chandra. Thank you so much for joining in. Dr. Praveen, what is the impact of smoking and secondhand smoke when it comes to heart health?
So, as we are already discussing, what are the preventive measures which a person or the society should take to decrease the chances of having a heart problem, especially because heart problem is really becoming so common, and at younger ages also. People drop dead. Many times you see on television, many newspaper items come in. And one of the very important risk factors for development of heart disease has been already established, which is smoking. And smoking is something, where there is it's not like, if you smoke 2 cigarettes versus 10 cigarettes, or it's not like a bargain affair. It is basically that smoking itself is a dangerous thing. It can lead to heart attacks even without a blockage. So we have seen this phenomena, that there is no blockage, but the patient develops a heart attack because the blood becomes thick and clotting formation happens inside the arteries of the heart, leading to a sudden heart attack. And in those patients, those people who smoke and develop a heart attack, they have a more severe heart attack. The chance of dying when they have smoking plus a heart attack is higher compared to a person who is having multiple blockages and has been having chest pain, etc. There the chances of dying at that particular heart attack may not be that much. So smoking is a very serious preventable risk factor, and which at all ages. Sometimes people say, okay, I'll stop after the age of 50 years because people develop heart attack at 50 years and beyond. But it should stop at any age. Like for example, even in young patients, we have seen in our practice in our hospitals that patients as young as 25, 30, 35 years of age, they have come with a serious heart attack, blood pressure going down, heart becoming weak. So all that happens primarily because of the smoking factor in these young individuals. But the other thing is that those people who are having diabetes, those people who are having high blood pressure, those people who have history of heart disease, they have the multiplier effect, which means if somebody has sugar, if somebody has blood pressure and is also smoking, he has 3 times more chances compared to a person who only has high blood pressure or has no blood pressure and only has diabetes. So that is why high risk individuals should not be smoked. So whenever we see a person who is diabetic and then he says, okay, I'm smoking also, that means it is a very, very bad combination. And if somebody is having a previous history of bypass surgery or previous history of angioplasty, if they smoke, they are going to have the second attack or a second angioplasty or a third bypass surgery very soon. So to prevent recurrences also, after bypass or angioplasty, smoking has to be completely stopped and prohibited, I must say. And so there is nothing like, I smoke 1 cigarette in a day, in the morning, 1 in the evening, or, so that should always be, kind of avoided. And now there are methods to stop smoking. So because there is something, which is very important, that those who are not smoking, they're fine. But those who are smoking, how to quit smoking. So quitting smoking is another big challenge.
Okay.
Because it is all very easy said and done. So we have to give them ways and methods to quit smoking. And of course, one is self-determination. Second is family support in this kind of situation. And the third is, sometimes there is a drug which we can give these days, which is helpful in quitting smoking.
Can I add, Nutan? Just a word, Nutan. Most of the time, the smoker's first cigarette is smoked between the age of 16 and 23. And it's usually due to peer pressure in the schools and the colleges. And then some of them might have smoked a couple of years and then gave up. But some unlucky ones get addicted. And as Praveen rightly said, tobacco or nicotine addiction is the most difficult addiction. I think it's worse than even a cocaine and very difficult to get rid of. So much so that sometimes they are so highly motivated to give up cigarette smoking, knowing fully well they try at their level best, but they are sometimes unsuccessful. As Praveen rightly said, it requires collective efforts from the family and also from the advisor, the medical advisor, to them to help them to get rid of it. It's very, very important.
Thank you so much, Doctor. At this point, the question is to Dr. O.P. Yadava. Doctor, what about alcohol consumption? Because we've had a very spirited discussion about smoking. What about alcohol consumption and what is its impact on cardiovascular health?
See, alcohol is a very emotive issue also, and it's been discussed for ages. Even our gods and lords have been taken it. The Last Supper of Christ was with wine. So, it's something, which has been, for a long period of time, we have said it's very good for health. To some extent, there was a reason. There is a moderate elevation of good cholesterol, very modest elevation, some kind of antioxidants may be present in it. But then we now realize that there are lots and lots of harms which are coming from alcohol. And today the position statement we maintain is that alcohol is bad for health and including heart. So we must realize that alcohol has a very complex interaction. For technical people, it has got an inflammatory response. It produces oxidative stress, it destroys the mitochondrial, it produces damage in them, and even leads to apoptosis or cell death. But for a layman, they must realize that it's a very important and a concentrated source of energy. 7 kilocalorie per gram is what alcohol contains. So it adds to weight. And that obesity we have just spoken is the root cause of lots of ailments. Then, we have problems that it produces other forms of dyslipidemias. It increases modestly the HDL, but then it also increases disproportionately the triglycerides, which are very harmful. It can produce irregular rhythms of the heart. It increases blood pressure, produces heart attack, may damage your muscles and produce what we call cardiomyopathy and heart failure. So there are so many strokes, liver damage, cancers. I can go ad nauseum with the side effects. So it's very important that we do not take to alcohol just because you read somewhere it is good for health. Certainly not. Yes, if you are taking alcohol, and the socio-economic aspect of alcohol should not be missed ever. The money you are spending, can you afford that alcohol? Are you taking that money out of your children's school education and from the wife's budget for running home? So those elements, the violence and the social things that it causes. But should you be taking alcohol, then you should be taking it in moderation. And there is no binge drinking. That's very important.
Thank you, Dr. Yadava. At this point, Dr. Mehta, what about regular exercise? How does that contribute to a healthy heart? And is there a way to have actionable points on quantifiable numbers when it comes to exercise? How much should we do? Dr. Mehta?
The exercise, surely. First of all, everybody should be exercising, whether you are having heart problem or no heart problem. The reason for that is the most important benefit that I tell from my own personal experiences. It gives you a tremendous sense of well-being. This is very, very important. Apart from this, the exercise helps to reduce the blood pressure. Exercise also is a stress buster, and exercise also helps to reduce the weight, as Rajeev mentioned. So all these factors are easily receive a benefit from regular exercises. And in general, I would say, for a heart point of view, that if man walks 30 to 40 minutes of brisk exercise, in other words, about 200 minutes per week, that I think is the list. More, it may benefit, may not benefit, but this is for sure that 40 minutes of brisk walk 5 to 6 days in a week, that should be done all the time. And I think there are other things also. We are doing exercises and advising exercises for the fitness, and it's not a competitive. But with those people who are in the business, such as they are in the sports or athletes, they have a different issue to tackle with, which I won't discuss at this point of time. But for an average man, this much amount of exercise is fairly good. The walk should be reasonably brisk. Jogging, I personally don't like, because the jogging increases the blood pressure and the pulse too rapidly, too high. Now that I think what Dr. O.P. Yadava and Rajeev briefly touched, that there is a sudden heart attack issue. We see sometimes people dying. Usually there are evidences and there are occasions where we notice that 12 to 24 hours after rigorous exercise, there has been an incidence of heart attack. This is attributed to a markedly increased stress, high or heavy exercises, and those people who are not used to it, they would suffer from high blood pressure and high pulse rate, which both combined together. The product of that will produce a stress and the rupture of the plaque that they were talking about. So a moderate exercise on a regular basis, right from day one, should be practiced.
Thank you, Dr. Mehta. That was really insightful. That what we need is moderate exercise, and I think that there are various longitudinal studies that kind of recommend brisk walking over jogging for various health and safety benefits. So thank you so much, Dr. Mehta.
Can I just add one little thing to what Dr. Mehta said? Now that's very important, because a lot of people say, I don't have time, the busy bees, the corporate honchos. So that is another recommendation we've got, is that you can collect the exercise in small aliquots of 10 minutes, 5 to 10 minutes. So even if you get time, your board meeting is 10 minutes late, someone is late, you go for a quick whatever you want to do exercise, that would be counted. Thank you.
Thank you so much, Dr. Yadava. That's a very useful insight of even 10 minutes counts, and that's really important. So, Dr. Praveen Chandra, what about stress? We did touch upon the topic, but what is the role of stress when it comes to heart diseases, and what are your recommendations on managing stress?
Okay, so we have already seen in one of the studies, which was actually done internationally, the Interheart study, which showed that stress is one of the additional risk factors. There were 5 risk factors to start with: diabetes, blood pressure, smoking, high cholesterol, and family history. But now stress has been identified also as a significant risk factor, especially in younger individuals. And because, why we are talking so much about young individuals? Because in young people, we don't want to lose them, because they are productive to the family, they are productive to themselves, and they are required for the society. So we have to protect the young individuals definitely and keep them as healthy as possible. And stress has been found to be very easily entering into the life of so many people today. And that is also one of the side effects of urbanization. And maybe now stress is also entering into the rural areas, but rural households. But stress has to be reduced, and stress I'm talking of mainly the mental stress. I'm not talking of physical stress. In fact, we want more physical activity, as already mentioned by Dr. Mehta and Dr. Yadav. But physical stress has to be reduced. So, the mental stress has to be reduced and the physical stress has to go up. So the mental stress reduction, how to do it? Again, this is the problem. How to bring down the stress, because you can't stop life. You cannot stop work. So how do we do that? So managing stress is a thing which one has to devise on his own, and also take the help of people who make them understand how they can manage time, how they can manage their work-life balance. And then, of course, the most important thing is that doing yoga, doing mental, meditation, all these activities actually finally reduce stress. So yoga is not a physical activity. It is both physical and mental activity. So yoga is a very important thing. Then relaxation, which is also going away from people's life because they want to achieve more, they want to work more, 7 days a week. So that relaxation goes away. Interaction with family, interaction with friends, and eating together. All these things are really, big. This is all the side effect of very hectic life schedules. So all that has to be considered, and people have to take time out, meet the family, talk to them, relax, and have some kind of a hobby also sometimes is very helpful in reducing stress. Like someone plays, someone goes for a swim, someone is reading. Reading is also a good, relaxation activity. And what are stress increasers? Stress increasers are that watching these, television for a long time, doing the surfing on the internet again for a long time, and playing video games, especially for young people. There are sometimes very, stressful video games which the people are playing as an obsession. All that has to be, kind of controlled. And in the end of the day, basically, balancing life is something which is very helpful to reduce stress, both at workplace and at home also.
Thank you, Doctor. Balancing life is very, very important. So thank you so much, Doctor. At this point, to Dr. Rajeev Menon, you have mentioned that, we have an extraordinarily high incidence of diabetes and hypertension, and they tend to be linked to cardiovascular diseases directly or indirectly. So is there a component of genetics that play a part here? What is the role of genetics when it comes to influencing chances of heart diseases?
Yeah, again, a very important question. Before I just touch upon genetics, just taking forward Dr. Praveen Chandra has mentioned about things which increase stress. I think watching the debates on news channel is one of the biggest stresses nowadays. The way people fight, you feel the world is going to end in the next half an hour or 1 hour if you watch any of those debates on the news channels. So, coming back to genetics, I'll just mention an interesting concept. If you look all across the world, if you see Indians who are settled in US, Australia, Singapore, or any other part of the world, studies have shown that there is a significant increase of heart disease among Indians compared to the other population. So in general, we know that Indians have a higher incidence of heart disease. This stemmed from a very interesting concept called as thrifty genotype and thrifty phenotype. What it basically says is over a period of centuries, Indian population or the southeastern population was used to famine because there was not enough food to eat. And genetically it got molded in such a way that we can survive for long periods of famine without dying. So when we got plenty, even the normal food which we eat, which we think probably we are having just 2 roti and 1 katori dal or with curds or some vegetables, which we think is normal diet, that itself might be surplus for us. So that was the concept which was put up, why Indians in general have a higher incidence. Now coming back to the one of the very important risk factors is the family history of coronary artery disease. We call it as premature CAD. That means if males below 45 years in the family, they have had heart disease, women less than 55 years, then the chances that these people will have a high risk of heart disease is known, and it has been proven. And if you look at Indian population, again, this is quite common. As I mentioned, we tend to develop atherosclerosis about 10 years earlier. And we had about 4 or 5 years back just analyzed our data in Hyderabad from the IT sector. And we realized that people who are in this high stress job of IT trying to actually get to targets, they have even 10 years earlier incidence of atherosclerosis. So the earliest patient of heart attack which we saw was around 22 years of age. And that patient actually came with a cardiac arrest, and then of course he survived. And when he was evaluated, there was no other risk factor. It was purely that he was going through so much of stress that he developed that. So genetics plays a significantly important role. People who have family history, we have a low threshold to investigate them aggressively, because these people tend to develop heart disease earlier, and they tend to present more with acute coronary syndrome. That means directly they present with a heart attack, which can cause significant heart damage. And we can't change our genetics, right? We can't choose our parents. So the other way of doing it is knowing that someone has a strong family history or genetically they are at a higher risk of developing heart disease. Make sure that you don't have any other risk factor. So control of diabetes, hypertension, absolutely no to smoking, both active as well as passive smoking. Reduce your stress levels, no obesity. So these are things, good exercise, diet, all these things take more importance when somebody has a family history of cardiac disorders.
Thank you, Dr. Rajeev. Dr. Yadava, as Dr. Rajeev mentioned, that there is an incidence of increased number of younger population succumbing to heart diseases. So under such circumstances, what are the benefits of regular cardiovascular screenings and checkups? And is there a particular age that you recommend to start the screenings?
Well, partly your question has been answered by my predecessors, including Rajeev. See, most of the diseases are what we go by kind of euphemistically, we call them silent killers. High blood pressure, high cholesterol, diabetes, they do not have any symptom directly of their own. They present when the damage is done to the heart or to the kidneys or a stroke occurs. So you get to know them much later. We almost say that it is like, if I use the word termites in the wood, when you get to know of the termite, the whole chocolate has been eaten away. So it's extremely important that to pick up these diseases, we need to routinely screen ourselves and not wait for symptoms. Now you said, what age was the second part of your question? Well, Rajeev said childhood. There is a Red Nose Day which is celebrated all over the world. You must have seen, we put red nose and money is collected. That is in support of what we call sudden infant death syndrome research. The Red Nose Day is celebrated to raise funds for that research. In the studies on those children less than 1 year age dying of some other cause, they found cholesterol deposition in arteries of the heart. So the prevention should start when the baby is in the mother's womb. If you are starting in childhood, you are late. And most of these habits are cultured, acquired, conditioned habits, excessive salt, excessive sugar. So this is what we develop in our child. When the first thing is born, you give them a shahad. 3 months, you start making them lick at lollies. We are developing this taste. I know whether you know, in Netherlands, less than 3 years, no form of food additive is allowed. You can't add sugar, you can't add salt by government legislation. It has to be natural food. So this has to be a service which has to be, as we say, womb to tomb. The prevention must start when the child is in mother's school, carry on through the childhood and the school days, canteens and all those. And it's extremely important. It makes economic sense. That's also very important. You spend money for checkup. No, but what about a penny stitch and tie saves 9? So it makes economic sense. The amount of days you lose from work, the mental stress you go through, these are all very important. So no question, preventive health check is very much desirable.
Thank you, Dr.
And Upi, to supplement what you said, Upi,
So
I think when I was in United States, I was doing the studies on the school-going children in Chicago, and 16% of the school-going kids had the cholesterol level of more than 300.
there you see.
And also those soldiers who died in Vietnam War, when their autopsy was done, they found a lot of them having plaques
Yes.
in the coronary arteries. So you see, you're right that it's a silent killer. And I think the observation, checking, carefulness should start as early as possible.
Thank you, Dr. Mehta. And the next question is once again to you, Dr. Mehta. We spoke about, especially younger generation or the younger group of people succumbing to heart diseases. Now, the connection between sleep and heart diseases has been finally established. Now, we also know that India is one of the most sleep-deprived countries, and especially if you take the IT sector, you find that people do not get sufficient sleep, and on top of it, they sleep in the morning. In short, they do a night shift, which is kind of again bad for circadian rhythm. So could you give us some of your insights when it comes to sleep and cardiovascular diseases?
Yadava, you want to take this question?
Sorry, sir?
You want to take this question, I said?
That's about the sleep you're talking of?
Yeah.
Well, yeah, sure, why not? I mean, sleep is something which is definitely very much essential. And today, sleep medicine has evolved as a offshoot, but now being developed as a parallel specialty. And sleep and cardiology are interacting. Things like when you have, snoring, when you have what we call in Hindi, karate bharna. Now that's not just a benign nuisance to a next door partner. No, it has got major events. When the tongue falls back, it obstructs your airway passages and you get that sound, and that raises inflammatory levels go up, certain hypoxia builds up, and heart attacks have been associated and other cardiovascular disorders have been associated with it. So it is not only just length of sleep which we recommend. One should have at least 6 to 8 hours of sleep, but it's also important the pattern and the type of sleep, which should be an undisturbed sleep. So sleep is extremely, extremely important. We should always make an effort that we do not see television or work on computer screens. It has been shown that the blue light which comes out of these screens, your mobile screens and television and computer screens, they keep hitting the rods of the retina. And once we switch these impulses off, that effect on the retina stays for anything from 60 to 90 minutes. So you just can't sleep. So have a congenial atmosphere, a reasonably warm or cold room depending on the time. Always have a yellow light when you're sleeping, a bed lamp. Take a small book, an easy book to read, and when you're sleepy, turn it off. Never get into a bed unless you are ready to go to sleep, otherwise you will keep tossing, and develop a rhythm. And very important to tire yourself out for the good sleep, and that could happen if you have a good workout. So I think these are some practical tips offhand I can give you.
Thank you, Dr.
I presume you were mentioning about, Yadava, you were referring about obstructive sleep apnea, OSA, which I think has been detected more and more frequently, a subject which was neglected in the past. Has become a very important subject now. And I think time and again, we find that people have all kinds of various manifestations resulting out of obstructive sleep apnea. Even forgetfulness, lack of concentration, the generalized weakness and whatnot.
Thank you, Doctor. So now the next question is to Dr. Rajeev. Dr. Rajeev, what is the connection between diabetes and heart health, and how can this be addressed specifically?
So diabetes is considered to be a cardiovascular risk equivalent. That means if somebody has had a heart problem versus somebody is diabetic, the risk of developing another episode of a heart attack or a brain stroke is equivalent. So that's the reason why diabetes is given extreme importance. And nowadays we have certain drugs by which the heart disease can be prevented. But previously, before these drugs came out, when you treat diabetes, many people have the misconception that because diabetes is under control, they will not develop a heart problem. That's not true. So these are called microvascular complications. When you keep the diabetes under control, the small vessel complications like eye retinopathy or the nerves or the kidney nephropathy and neuropathy, those are the ones which can be controlled. But the macrovascular complications still tend to progress. Nowadays, we have some drugs by which we can prevent that also. But again, suffice here is to mention that diabetes is equivalent to heart disease. So control of diabetes is paramount in order to prevent the patient developing cardiac problems. And unfortunately, we are the diabetes capital of the world.
Thank you, Dr. Rajeev. Being the diabetes capital of the world, extremely important to make sure that we have it under control, because otherwise it comes with its lovely sister, and that being cardiovascular diseases. So thank you, Dr. Rajeev. Dr. O.P. Yadava, where you've been very passionate and very vocal about sleep. So what about heart-healthy lifestyle for children and teenagers?
Well, I can't stress it more, and I think we've been talking about it. The realization has to be there. First, that's very important. Sensitization, and more important, it's for the parents, because they are the ones who are setting an example for the child. So, as he mentioned, for a sick patient, boiled food and you're eating dollops of ice cream. Similarly, the parents have to set the example of getting the right high fiber diet, getting them into outside world and sports rather than computer-based sports. The canteens in the school, they have to look at what they're serving to the students. That's extremely important. For commercial reason, all these aerated drinks and sodas, which are empty calories and the single most damaging element in the food, they should be taken off. All Mehta-based products should be taken off. You should serve them, fresh fruits. They can be sold in the canteens. So those are very important. And screening of the children is very important. Not only high cholesterol, 30-35% of children in the schools are overweight. We don't realize. And we are talking of heart, but person may have eye problems. So it's very important that health checks for the children are done. So I think the school health is the most important thing. No point in acting once a person has developed a disease. That's the right age to attack them.
Thank you, Doctor. Prevention is definitely much better than cure. And with that, to Dr. Mehta, how can one effectively control or reduce high blood pressure? What are your suggestions for that?
I think that first of all, let me clarify misunderstandings that are prevailing, the myths about the blood pressure. What is blood pressure? The blood pressure is the outward pressure expressed onto the walls of the artery by the column of the blood. Now, when there is a strong heartbeat, at that time the blood pressure is high. When the heart is relaxing, the blood pressure at that time is low. Upper blood pressure, lower blood pressure are by that I mean that when the heart is contracted, you get an upper blood pressure. When the heart is relaxed, you get a lower blood pressure. On an average, I feel that by and large, generally, to have the blood pressure of 120/80, most of the time in your day-to-day life, most of the time, if that blood pressure is maintained, I think you are maintaining a very good blood pressure. Though the blood pressure does vary with the age, and at times the high blood pressure of an elderly people is sometimes very difficult to control no matter what you do, and that is due to change in the structure of the arteries, the structure of the walls of the vessels, and that I think are systolic hypertension. Let me put it in general this way. Newborn babies have a low blood pressure, as low as 70 to 40. The young kids have to about blood pressure about 100, 110. Adults have to about 120 to 130/80. Elderly people should be having around 140, 150 blood pressure. This is acceptable. Trying to lower too much sometimes produces symptoms, and therefore these are the reasonable blood pressures. Keeping the answer brief.
Thank you, Doctor. Thank you. That was really brief indeed and very to the point. Dr. Rajeev, at this point, are there any specific age-related considerations for heart care?
As I think it was already discussed in the forum, that what is healthy, what is good, that is universal. It doesn't matter whether it's a child or it starts right from the intrauterine age and goes on till the elderly people. But a word of caution here is whenever somebody is trying to do something drastic or starting off with exercise specifically, after a particular age or people who have risk factors, it's always better that they consult a physician, do the required tests, and then go ahead with it. Like say, someone at the age of 45 suddenly decides that he's going to start gymming, and he doesn't even check his blood pressure, and his pressures might be some 180, 100 or 200, 110. He goes to the gym and he can develop intracerebral hemorrhage. So someone who is at least above 35, 40 years, at least a basic investigation, a consultation by a physician, and then starting exercise will be beneficial. Those who already have risk factors, say a heavy smoker, someone who is already hypertensive, diabetic, has high cholesterol, has a strong family history, they again should consult a physician before they go on and then start some aggressive form of exercise. Other than that, there are no specific recommendations age-related. Always important that you start slow and then increase it slowly. One of the major reasons why people get put off by exercise is the first day they go, they want to do everything which the best athlete is capable of doing. That's not how the body responds. So start at the lowest possible level every week, every 2 weeks, keep going up. And then many of them will be able to achieve very, very good degrees of exercise tolerance and fitness.
Thank you, Dr. Rajeev. Dr. Yadava, what are the latest advancements and research findings in heart care for prevention?
For prevention, one, I would say, besides the mundane, we all talk of technological advances, of wearables, of remote sensing, remote monitoring, and all that kind of technology-based advances. I would say the realization that the gut and the heart are related, and a lot of problems of the heart are coming from the gut. That next decade, you're going to find gut microbiome is going to define a lot of heart problems and other problems. So that's one important advance and would have some relevance. Second is genetics. We are now doing genetic editing. I mean, it's not just figment of imagination or some theoretical thing that maybe 10 years down the line, you walk into a doctor's clinic and they take a buccal mucosa, you sip a cup of tea. By that time, they do your genetic screening and come out, this gene needs changing, and then they do gene editing and you walk out. So that kind of a thing is going to come. And third very important thing is a behavioral change. We are shifting from, we were talking of always prevention. Now the focus is on wellness, not on prevention. Even the Sustainable Development Goals have included wellness. So healthy cities, healthy neighborhood, having roads, parks, collateral, instead of seeing it as a silo-based specialty, collateral thing, minor engineering works, good water supply, roads, all these integrations are going to help us a lot, including integration of alternative and holistic medicine. Thank you.
Dr. Yadava. That was really holistic in your answer itself. You covered everything from inside the body to external in terms of cooperations and collaborations. So thank you so much, Dr. Yadava. It's been an absolutely informative session. So thank you so much. Unfortunately, we only have time for that today. So I would love to thank each one of you. So Dr. A.B. Mehta, thank you so much for your time and for your insights. Dr. Praveen Chandra, thank you so much. Dr. Rajeev Menon and Dr. O.P. Yadava, thank you so much for your time, your insights, and your wisdom. Hopefully, with all the information that you have shared, we would be able to prevent some of the patients that might have otherwise come to you. So thank you so much.
Nutan, something on a lighter vein, Nutan. Something on a lighter vein. You don't drink alcohol. You don't eat sugars. You don't eat. I mean, you do not have any stress whatsoever, and you do not smoke. You do not enjoy. For those things people who enjoy this, you may live up to 100 years or not, that I don't know, but you will feel that you are 100-year-old.
You, sir, you must always have the last word.
Thank you.
Dr. Mehta, we should get them into trekking and a lot of other things. The life out there is much more beautiful than just smoking and drinking.
Yes.
But then it is true for many people. If you disconnect them from these little pleasures of life, they might find themselves feeling very old. But that being said, let's hope for everyone finding what makes their life fulfilling and live a healthy, happy life. So thank you so much for joining us for the TOI World Heart Day Symposium 2023, where every beat counts. Thank you so much, and we have really explored how to care for your heart. Thank you once again for all your insights. Let's carry this knowledge forward, making sure every beat counts for a heart-conscious future. So thank you.